Hello viewers, today's topic is on chronic prostatitis. So now chronic prostatitis is a cumbersome issue which is seen in some patients, which is actually a chronic issue, and it's little tricky and difficult to treat. And most of the doctors, they try to avoid treating these chronic prostatitis patients, because these patients, they take a lot of time. Every month they come back with the same issue. Finding the right solution for these patients may be tricky sometimes, and patient is already in depression, and chronic pain, it actually demotivates them from doing their regular works. So now, what are the common symptoms of chronic prostatitis, and how do you understand you are having a chronic prostatitis? So now the symptoms, what I am going to tell you, probably these symptoms may be in other diseases also, but they change. So now you can easily differentiate between other diseases and chronic prostatitis. The first common issue is urinary issue. Sometimes there is chronic dysuria. Every time a person passes urine, there is pain in the urinary tract. It can be burning sensation, but most of these patients, they must have visited a neurologist. All their urinary examinations, urinary scans, KUB scan may be normal. So then they must have tried some urinary antibiotics, and then they come to us. So now here, in spite of all these negative urinary findings, where they must have done urine culture, regular urine examination, and ultrasound scan of kidney, urinary bladder, all these scans and tests may be normal. But if there is chronic burning sensation in the urine, then it must be prostatitis. Second one, persistent premature ejaculation. That means people who are having severe premature ejaculation with no medication working for them, then the reason can be either chronic prostatitis or seminal vasculitis. And third one, chronic testicular pain. People with persistent testicular pain which is not getting relieved in spite of taking antibiotics, n number of antibiotics and anti-inflammatory medications, then it can be prostatitis. And penile pain. People generally they come to us saying that there is a pain in the penis. Sometimes it is on the top, sometimes it is on the side, and sometimes it is in the lower part. So now this chronic penile pain, again the infection is not in the penis. The main reason should be in the prostate, because of the nerve irritation, the penile nerve which goes inside, and it goes just below the prostate, passes just below the prostate. That nerve gets infected because of the chronic prostatitis, and because of that they get penile pain. So now these are the issues what we see in prostatitis. And there is a terminology. See, now you can't differentiate this. You can't put all these symptoms into a basket. So now they call it as chronic pelvic pain syndrome, which is also called as CPPS. That means for one person it can be suprapubic pain, one person it can be testicular pain, one person it can be penile pain. So for some people it is perineal pain. Perineum means the place below the anus and scrotum. So now what are the reasons for this chronic prostatitis? One, this can be sexually acquired infection. Two, it can be a bacterial infection. And again, the origin for this bacterial infection can be urinary tract or large bowel, because this prostate is close to, it just sits between urinary bladder and the large bowel. So now any infection either in the urinary bladder or bowel, it can lead to prostatitis. So now this prostatitis or seminal vasculitis. Now if there is constipation or piles, basically we call them as hemorrhoids, anal fissures, irritable bowel syndrome or inflammatory bowel disease, Crohn's disease, lower bowel ulcers, all these things. See, normally the bacteria which are in the bowel are normal in the large bowel. So now these bacteria, when they enter into the genital tract through this prostate, then it leads to abnormality. So this prostatitis, chronic prostatitis, can cause infertility, it can cause severe premature ejaculation, testicular pain, penile pain, urinary issues, chronic dysuria. All these are the effects of prostatitis. Now, how to treat this prostatitis? There are again 3 ways of treating this. One is medical treatment, 2 is shockwave therapy, third one is surgical therapy. Generally, prostate gland may not be enlarged in prostatitis. See, enlargement comes only after 55 years, not in chronic prostatitis. Sometimes you may find little enlargement in the prostate. Normally, the normal size of prostate is 15 to 20 cc. In these prostatitis patients, you may see around 20, 24, 25 cc size, but most of the patients, they will have normal size. So that is why surgery is not necessary in these patients with chronic prostatitis. So now the main idea or the goal in treating these patients is identifying the organism which is causing prostatitis. So sometimes doing prostatic massage and then semen culture will tell us what kind of infection it is. So now this infection can be a bacterial infection, fungal infection, and or viral infection. So you have to find out the cause. Sometimes even herpes simplex virus, which transmits through oral sex or kissing, even this can cause prostatitis. So now you have to identify the organism, then you have to start. And always high dose antibiotics will never work in chronic prostatitis. And latest 3rd generation cephalosporins, where we use them for other organs in the body, generally they don't work for prostatitis. For prostatitis, always treatment is low dose antibiotic for long term usage and along with anti-inflammatory medications, and sometimes we may supplement with medications which decrease prostate size. And always this treatment may take around 3 to 4 months time, but in spite of taking these medications for 3 to 4 months, if these symptoms are not coming down, then there is a therapy called low intensity shockwave therapy to the prostate, where this is a very simple OPD based therapy which is painless, and it's an external therapy. There is no insertion of any tool into the body, and these shock waves are targeted at prostate, and once this prostate gets these shock waves, generally there is an anti-inflammatory effect and the blood supply to the prostate increases, so that it helps in healing the internal infection. So viewers, now we discussed all the possibilities for prostate infection and how to treat it. In spite of if you are having prostatitis, or your known friends or relatives, if they are having prostatitis and if they are suffering with these symptoms, forward this video to them. At least this will help them in coming back to their normal life. And if you have any queries, please post in comment section so that we will try to reply through a fresh video. Thanks for watching.